we presented the results of an imaging sub-study in a prospective study dedicated to newly diagnosed transplant-eligible patients with multiple myeloma that we ran in Italy. The name of the trial is FORTE Trial. So within this trial, there was an imaging sub-study planned with the aim of confirming the prognostic utility of this imaging technique to discriminate the prognosis of patients, and also with the aim of use the standardized criteria for evaluating the response that we previously proposed to be used in clinical trials and in routine clinical practice. We were able to prospectively study all the patients at baseline and at the end of induction therapy and prior to maintenance with FDG-PET CT, and to apply to those imaging technique the Deauville criteria that we previously demonstrated as useful in this context to apply a sort of standardized interpretation for PET CT in multiple myeloma. So all the patients were studied, let's say, in a planned way, and they receive standardized criteria for definition of positivity and negativity. We studied 189 patients, and what we found was that approximately 70% of them achieved a complete metabolic response as previously defined, that is to say, a residual eventual uptake of FDG below the threshold level of the liver. So we use the liver as a cutoff. The achievement of complete metabolic response in this 70% of the patient significantly and favorably influenced both progression-free survival and overall survival. So the patients with a complete metabolic response achieved a better outcome. And also another important result was that the negativity in PET CT was complementary to the negativity of minimal residual disease as evaluated in the bone marrow by flow cytometry and next generation sequencing. And so patients who achieve both negativity in the bone marrow with these techniques and negativity outside the bone marrow by PET CT experience the best prognosis in terms of progression-free and overall survival when compared to the patient that were either both positive for the different techniques or either positive in the bone marrow or outside the bone marrow. So the achievement of minimal residual disease negativity inside and outside the bone marrow was associated with the better outcomes of the patients. I think that the importance of this study resides in two aspects. The first one, that we were able to reproduce our previous results and thus applying these standardized criteria for PET interpretation that are based on the Deauville criteria demonstrated to be reproducible. And I think that this is important because it means that everyone, both in routine practice or within clinical trials, can use this definition of complete metabolic response. And the second important point is that PET CT demonstrated once again to be complementary to bone marrow techniques, and thus the evaluation of minimal residual disease both inside and outside the bone marrow turned out to be the best way to identify a subgroup of patients with a particular good prognosis after treatment.